A bandage is a piece of material used either to support a medical device such as dressing or splint, or to provide support or to restrict the movement of a part of a body. When used with the dressing is applied directly on a wound and a bandage is used to hold the dressing in place. Other bandages are used without dressings, such as elastic bandage, that are used to reduce swelling or to provide support to the sprained ankle. Tight bandages can be used to slow blood flow to an extremity, such as when leg or arm is bleeding. They are available in wide types, but for this video we are using the roller gauze type bandage. Roller gauze bandages are available in different lengths and widths and can be applied for almost any type of bandaging. The materials required are crib or roller bandage, scissor, surgical blade, gauze, gloves, mask, medical tape, iodine or alcohol spirit, normal saline, artery or a forceps, drapes or sterile sheets, and the materials mentioned are not required for every type of bandage, but they should be available while performing this procedure. Some bandages also require some special material which are not mentioned in this video. Sterile or clean technique is used for the donning of the gloves. The area is cleaned thoroughly by using an antiseptic solution like alcohol. Skin is assessed before the application of the bandage. Also observe circulation by noting the pulse, skin color and temperature. Moving on to the 5 basic turns. The first one is the circular turn. The first are the 2 circular turns given horizontally. It is used to secure a bandage at the beginning or at the end. It should not be used around a limb as it could interfere with the circulation of the blood. When each complete turn of a bandage form a figure of 8, this is called the figure of 8 turn. It consists of overlapping turns, each of which crosses at a midpoint and descend alternatively. It is used over a joint and as an alternative to the reverse spiral turn. To avoid the tourniquet effect, bandages are not applied too tightly. Spiral turns are used to carry the bandage spirally up the limb. When a spiral bandage has a reverse turn, it is called reverse spiral. It is used for the part of varying dimensions like forearm. When a series of alternating turns are made, this type of turns are called the recurrent turns. After 1 or 2 spiral turns, the initial turn is made across the middle of the area to be covered, and the succeeding turns pass to and fro over the end of the first one side, then the other of the initial turn until the entire area is covered. Finally, the bandage is completed with 1 or 2 spiral turns. This pattern is useful when applying a bandage to the stump of an amputated limb or to the head.